Atrial fibrillation, or AFib, a deadly heart rhythm irregularity. 40% of us will develop it in our lifetimes, burdening us with a 5 times greater risk of stroke. 60% of AFib is silent or asymptomatic, thus extremely difficult to detect. Early detection is a lifesaver, as treatments vastly reduce that risk of stroke. Standard of care for detecting AFib is the 24-hour ECG Holter monitor. These cumbersome Walkman-sized devices connect wired electrodes adhesively to your chest, yielding just a 1% chance of detecting silent AFib. Mobile ECG devices, like patches and smartwatches with ECG, are power-hungry and inoperable while wet. They cannot offer the 90 days of continuous heart rhythm data experts say is needed to reliably detect silent AFib. So we have a real unmet market need for long-term, continuous, convenient heart rhythm monitoring. Galenband delivers just that. This is Galenband, a revolutionary heart rhythm monitor which records ECG-like waveform without using ECG. Galenband is a patent-pending Class 2 medical device and AI platform. It records heart rhythm 24/7 for up to 90 days, giving silent AFib patients an 85% detection rate versus that 1% with 24-hour ECG. Key opinion leaders are excited because Galenband streamlines their workflow, and uniquely, it unlocks new patient care pathways based on our long-term, continuous, convenient heart rhythm insights. AFib monitoring is a €1 billion opportunity, and Galenband's clinician-centric business model will generate highly profitable and recurring revenue using established reimbursement codes. We've been generating human data for 6 months. Our HPRA-approved clinical study completes by March, and we are seeking funding to attain CE mark and FDA approval prior to market launch in 2023. Our dedicated and passionate team have a rich background in the medtech and software arenas, and I have co-founded and led 2 high-growth software platform businesses. In summary, Galenband reliably detects silent AFib. We have novel IP, a defined regulatory pathway, a scalable business model, and a team eager to execute. We are now seeking the right partners to join us on our mission to reinvent mobile heart rhythm monitoring. Thank you.
Thank you very much, Eddie. And just inside the 3 minutes too, couple of questions. Who will you be selling this to? Is this direct to consumer or business to business?
Yeah, this is B2B. It will be prescribed only by clinicians. We have a clinician-orientated business model. So it's clinicians who prescribe it for patients, and then it's paid for by the patient's medical insurance.
You showed us the band on your hand. Now, is it possible that you could develop the technology so that it could fit into a smartwatch, for example, rather than the band you showed us?
No, not really. The difficulty that smartwatches have is that, in effect, they're Swiss Army knives. They're doing a million different things at the same time. And the difficulty with detecting silent AFib is that it's intermittent and it's asymptomatic. And so with smartwatch technology, you would need to be, it would be difficult for the smartwatch to be able to give you that long-term continuous monitoring. So this is a specialist device designed specifically to monitor over a long and continuous period.
What do you know of competitors who are trying to do the same as you're doing?
Yeah, so I guess there's 2 fields of competitors. There's the ECG Holter monitors, which are, they have difficulty in detecting it, and they're impractical to wear and inconvenient. With smartwatches, they're typically using an ECG sensor, but they only work for 30 seconds at a time, and they require manual intervention. So we've gone down a different road with a different type of sensor designed specifically to work over the long term in order to detect this very difficult to detect disease.
In the 20 seconds we've left, how quickly do you think you can scale up this business and make a return for investors?
We can scale up this business starting with our launch in 2023. We will break even with a modest investment by 2025. And by 2027, we will achieve 30 million in revenue.
Eddie, thank you. Our 2 minutes is up. Thank you very much for your presentation.